Good morning, and thanks to everyone who's joined the call so far. We're scheduled to start at 12 p.m. Eastern Time, so we'll be back to get started in just about 3 minutes, but thanks for being here. Welcome, everyone, and thank you for joining today's event hosted by the Council on Criminal Justice. Yesterday, the National Commission on COVID-19 and Criminal Justice released its latest impact assessment, detailing an 8% increase in domestic violence since the start of the COVID-19 pandemic. While the root cause of this increase has yet to be determined, the vital importance of addressing violence and COVID-19 in our communities is clear. Today, we'll welcome leaders from community-based organizations who have been working on the front lines of this issue since long before coronavirus entered our day-to-day existence. I'm Abby Walsh. In addition to staffing the commission, I'm a vice president here at the Council on Criminal Justice. If this is your first council event, welcome. The council is an independent, nonpartisan think tank and invitational membership organization. Through our membership, our analyses, our task forces, and our events, the council serves as a center of gravity for the criminal justice field. Over the past year, we've worked to provide our members and the field in general expert guidance as they navigate the coronavirus pandemic. Before we begin our program, a few notes. We'll be joined by nearly 600 participants today, including policymakers, the public, and the media. To ensure a quality experience for everyone, all lines will be muted, but we want to hear from you. So throughout today's session, you can submit questions using the Q&A box at the bottom of your screen, or email us at info@counciloncj.org at any time during the call. You can also join the discussion on Twitter by following our handle @CouncilOnCJ. We will take as many of your questions as possible at the end of today's session. With that, I'm pleased to introduce Thomas Abt, Council Senior Fellow, Director of the National Commission on COVID-19 and Criminal Justice, and a national expert on urban violence reduction. Building upon his experience in the New York Governor's Office, the U.S. Department of Justice, and as a senior fellow at Harvard's Kennedy and law schools, Thomas's work on violence reduction has been featured in major media outlets, detailed in his book, Bleeding Out, and viewed more than 150,000 times in his TED Talk. Thomas, the floor is yours.
Thanks so much, Abby, and welcome everyone. I'd like to begin with some sobering statistics. The Council recently looked at crime rates in 34 US cities during 2020 and compared them to the year before. We found that homicides spiked by 30%, a potentially historic one-year increase, and that represents more than 1,200 deaths in just our 34 sample cities. Aggravated and gun assault rates also spiked higher in 2020. As you heard, domestic violence also increased during the pandemic, based on a separate review of 12 US studies that the Council released just yesterday. These spikes in violence are cause for deep concern, but let's also remember that violent crime rates are still well below the historically high rates we saw in the 1990s, and that property crime and drug crime rates, with the exception of motor vehicle theft, fell significantly last year. So what can policymakers and practitioners do to stop violence and save lives? Fortunately, there's some good news in this area. Obviously, police play a role in controlling crime, but there are other strategies that don't put law enforcement at the center of the anti-violence conversation. And several of these strategies have a strong track record of success without passing new laws or big budgets. I want to introduce you to 4 of the strongest strategies today: focused deterrence, street outreach, cognitive behavioral therapy, and hospital-based violence prevention. Over the next half hour or so, we'll hear from leading experts with concrete experience in each of these approaches. We'll take a very concrete, pragmatic approach, going quickly through how these strategies work, research and evaluation, implementation, the role of law enforcement, and what it actually means to be community-based, a term that sometimes causes some confusion. Okay, now let's meet the experts. Paul Carrillo is the co-founder and executive director of Southern California Crossroads, a nonprofit organization that provides young people with alternatives to gangs, drugs, and violence. Over his many years in the field, Paul has provided youth and gang services in schools, hospitals, jails, and in various communities throughout Los Angeles. In 2012, Paul co-founded the annual LA Gang Violence Prevention and Intervention Conference, which brings together professionals from around the world to share best practices, data-proven models, new trends, and solutions to youth and gang violence challenges. He has also been awarded the Hospital Hero Award by the Hospital Association of Southern California for implementing hospital-based violence prevention programs in LA County. Javon Gregoire is the Deputy Director for READI Chicago, where she helps oversee the management and implementation of the READI Chicago strategy. Javon has dedicated her professional career to bringing meaningful resources and impact to marginalized and underserved populations. She served as the Chief of Staff for the Division of Family and Community Services within Illinois' Department of Human Services. She's worked with legislative focus groups to recommend changes in state policy. Javon holds a bachelor degree in psychology from the University of Illinois and a master's degree in professional counseling from the Illinois School of Professional Psychology. David Muhammad is the executive director of the National Institute for Criminal Justice Reform. Through the Institute, David provides leadership and technical assistance to the ceasefire gun violence reduction strategy in the cities of Oakland, Stockton, both in California, Portland, Oregon, and Indianapolis, Indiana. He has helped numerous offices and organizations implement successful violence reduction strategies around the country. David has also worked as a federal court-appointed monitor, overseeing criminal and juvenile justice reforms in numerous jurisdictions. Finally, David was the chief probation officer in Alameda County, California, where he was responsible for overseeing over 20,000 people on probation, a staff of 600, and a $90 million budget. He also served as the deputy commissioner to the New York City Probation Department, the second largest in the country. He served as the Chief of Committed Services for Washington, D.C.'s Department of Youth Rehabilitation Services. Fernando Rejon serves as Executive Director of the Urban Peace Institute. For more than a decade, he has led efforts to transform systems and the lives of individuals to create peace and safety. Fernando began his career as a trained community organizer, and with over 18 years experience, he's worked in the nonprofit sector. Since then, among other accomplishments, he has trained thousands of leaders nationally on the role of gang intervention and the development of non-traditional community safety strategies. He has also trained and advised numerous law enforcement agencies all across the country. In 2019, he co-created the National Street Outreach Partnership as a platform to serve these frontline intervention organizations. Fernando holds a BA in Sociology and Communication Studies from the University of San Diego and an MA in Chicano Studies from California State University. Welcome, everyone. Okay. Now that we've met everyone, let's get started. We're going to move quickly here as there's a lot to cover. I've told our panelists that they have 2 minutes each to answer each question, so I'm going to apologize to them in advance if I have to gently interrupt if they go over their allotted time. Let's begin by introducing each of these strategies. Javon, let's start with you. READI blends subsidized employment with cognitive behavioral therapy, otherwise known as CBT. I'd like to focus on the CBT aspect for now. What is CBT and why is it so helpful in terms of violence reduction?
Thank you, Thomas. So first, CBT, or cognitive behavior therapy, is an umbrella of techniques that's designed to do two things, especially as it relates to violence reduction. First, it's designed to allow space to understand how we relate to our internal and our external experiences with intentional focus on our thoughts and our behaviors. It also allows us opportunities to try on and learn about new behaviors and new thoughts. The only way that I can kind of tell you how effective cognitive behavior therapy can be for violence reduction is to briefly tell you about an interaction to which I had with a young man who, once I visited in a reentry center, he discussed with me that period of time before an agitator of violence typically is getting ready to possibly commit a crime, and there's 5 seconds to which everything stops. Their world stops, everything is silent, but their life flashes before their eyes. And in that moment, which seems so like an oxymoron because your world stops, but at the same time, you see so many flashes of your life, you're waiting for someone to tell you to stop or something to tell you, don't do it, think it over. Cognitive behavior therapy gives our individuals the tools to empower themselves to be their own voice, to be that own something, to say stop, don't do it, and then to re-alter their behaviors to more healthier ones than the maladaptive ones.
Thank you, Javon. Paul, your organization, Southern California Crossroads, does hospital-based violence reduction, among other things. Can you tell us about that approach and how it works?
Sure. I've been doing hospital-based intervention since 2001, and there are various versions of hospital-based violence intervention. My job when I arrive in the trauma bay, when a penetrating wound arrives, is to make sure that everybody is safe, the patient, the family, the medical staff. Sometimes we can get rivals that arrive at the same time, or sometimes we have a rival that is already admitted and then a new gang member arrives. So that's number one. Second is I'm allowed to be in the trauma room. Many organizations that provide a version of hospital-based intervention are not allowed in the trauma room. For me, this is critical. Hearing the report from the paramedic allows me to piece together what transpired. I also look at the tattoos of the individual that can also inform me on what particular gangs or groups might be involved. And immediately I start texting and calling the street intervention workers, some of whom are my employees and some that work for other organizations, so that we can create a coordinated response. Again, engaging the family is very critical to keep them calm in the meantime, while the doctor can give them an update. It's a very intimate moment that me and my team are privileged to be a part of. Dr. Shaka Shepard is the chairman of our board and the director of trauma services at St. Francis Medical Center, and is always very welcoming and inviting us to be a part of that process from the beginning. All hospital-based intervention efforts are valuable. but they're not the same. The objective is to take advantage of that teachable moment, so to speak. And if you're working with active gang members, you're probably never going to have their full attention, short of being able to engage them in the hospital or in jail. That's just the truth. There are two types of patients. A lot of people don't know this. You have your survivor of violence, so to speak, and then you have your survivor/gang member. And you have to approach both differently. You can't approach them both the same way. Many organizations struggle to engage gang members because they're very difficult. And so that's when having team members from the community helps to be able to communicate with them and create those relationships. So just differentiating between those two approaches is very important for my work.
Thank you, Paul. Fernando, let's turn to you. The Urban Peace Institute trains street outreach workers all across the country. The work goes by other names as well. Can you tell us how street outreach stops violence?
Sure. Thank you for inviting us here, and shout out to all our colleagues that are in the audience. Thanks for the support. So street outreach, gang intervention, violence interrupters, violence intervention workers, just in general, we say peacemakers. Many times peacemakers have lived experience. They come from the streets, sometimes formerly incarcerated, formerly involved in the street violence. What they do is they have what we call a license to operate. So credibility in the community and in the neighborhoods where there's high impacts of violence. And so during crisis, when there is a disagreement, when there is conflict between two different neighborhoods, maybe 3, 4 sometimes, they can go in and engage those who are most isolated from systems, right? They can go in there and reach the hard to reach populations and have conversations that provide alternatives to violence, a voice of reason, for non-aggression agreements, shuttle diplomacy. So that's a really important piece. The tip of the spear when it comes to violence is having trained professional violence interruption workers to be out there to engage those who think there's no other option to settle disputes. So that's a very important piece and a critical piece to reducing violence. But in addition, the case management, the street CBT, right, that Javon spoke about is very important. Like the behavioral change component is so important. And sometimes people aren't going to be formally go through case management. Sometimes it's very informal case management where you can talk to people, provide them options. And when they're ready to change, they know that there's somebody there who's consistent and who will be there for them when they're ready to make that transition. So street outreach workers, I think, are critical to public safety. And part of their work is to ensure that young people that are in these communities that maybe only law enforcement is focused on have opportunities and have options to resources and to violence.
Thank you, Fernando. I think it's an important point that none of these strategies are mutually exclusive. Policymakers can and should be considering multiple strategies at the same time and making sure that they're coordinated with one another. David, let's turn to you. Your organization trains people on a strategy called ceasefire or focused deterrence, among other names. Tell us about that strategy and how it works.
Thank you. It was a good segue in terms of multiple strategies and coordinating with one another. In most of the cities that we've worked in, it's ceasefire, focused deterrence. I focus deterrence. I happen to like gun violence reduction strategy, but the focus is specifically on reducing gun violence, and so it's a very specific goal, and therefore the set of strategies or activities or programs are specifically designed to reduce gun violence in the near term. There's 4 primary components of the strategy. One is data-driven identification of the people who are at the very highest risk of gun violence. Despite kind of popular opinion, there's only a small handful of people who are involved in gun violence in any particular city. Second is direct and respectful communication of that risk to those individuals, to inform them of their risks, like a public health model where you, like during COVID, you want to tell people who are over a certain age, who have underlying health conditions, if you contract the virus, you have a much likelihood of having a much worse condition. A higher likelihood of having a worse condition. And so we're informing these individuals of their risks. It's not a scare straight, it's not a scare tactic. it is direct and respectful information. Third, and extraordinarily important, is the provision of services, supports, and opportunities to engage these folks who are at the very highest risk with actually some of the aspects that have been talked about, outreach, CBT, but a very important piece of this strategy is intensive life coaching, using a credible messenger, someone with a similar lived experience, to engage this person in a positive relationship. You may not connect them to services immediately, like the good point Fernando made, but you want to have a positive relationship with them to gain influence with them, to help them make better decisions. And last, and as a last resort, is focused enforcement, that if folks who have been offered opportunity and informed of their high risk continue to engage in gun violence, not take the services. It's not the carrot and stick that people falsely say it is. If they continue to engage in gun violence, then as a last resort, it is really focusing enforcement on this extraordinarily specific set of behavior. And that combination of strategies has proven effective in reducing gun violence.
Thank you, David. It's interesting. Among all four strategies, there is this core component of identifying the highest risk people and places, and then really preventing retaliation between and among those people. So thank you. Let's turn to what it means to be evidence-based in this area of violence reduction. Javon, all these approaches that we've just discussed have been formally evaluated. Why is it important to study these approaches and to assess their effectiveness in a rigorous way? And Javon and Fernando, after Javon goes, would love to hear from you.
It's really simple. It's very important to know what works so we can do more of it, especially now during a time where we're clamoring for innovative strategies to an ever-evolving issue. It also allows for even the most well-intended interventions to become more socially and culturally relevant and appropriate to the intended service population. At READI Chicago, our program is connected to an RCT with the University of Crime Lab. So in an effort to determine if our intervention in terms of reducing the risk of gun violence involvement for those at the highest risk, we wanted to measure three things. Number one, could we find the right men? Number two, could we engage them meaningfully? And three, could we overall and ultimately reduce their instances of violent offenses or being a victim of violent offenses? So our data, even though we're only midway through the point, is showing, number one, we are finding the right men. Our men range from 14 to 18 convictions, with 4 or 5 being felony convictions. They have 46% of them have been a victim of violence, with 34% being shot at least once. 84% of our men have lost a loved one to violence. And we're not talking a neighbor, we're not talking a friend, we're talking a mother, a father, a child even. And if you really want to get more linear or granular in terms of how our men compare to the citizens of Chicago specifically, are men that's in the control group, meaning that they are similar in every makeup to those that participate in READI, other than they don't have the READI intervention. They are 55 times more likely to be a victim of a gun violence. So yes, we're finding the right men. We initially thought that we could engage them at a rate of about 27%. We are now showing that we are engaging them at a rate that's twice as much. So that really shows that if you build it, they will come. They want services. They want to be supported. And lastly, ultimately, and again, because we're still midway through the evaluation, but our data is showing promising results in terms of reducing the likelihood of shootings and homicide victimization and arrest, which we all know is the costliest of all the violent crimes.
Thank you, Javon. Just a point, RCT for the audience means randomized controlled trial. It's one of the strongest methodologies for research out there. Fernando.
Yeah, so, as the country is reimagining public safety, the country is reckoning with legacy of racism. We're looking at the impacts of over-policing on communities of color. I think we need to proactively shape the national narrative about this work. This work has been proven, it has been evaluated. So we've seen evaluations come out from Advanced Peace, from David's group. We've seen Cure Violence. In LA in particular, we've seen a 41% reduction in retaliation. We've seen a new report just came out with over the 10-year period, there's an 18% reduction in crime and violence in areas where there are gang injunctions. So it helps to support the argument that suppression alone is not going to increase safety, that you need other treatment programs. And so taking this to scale, I think, is important, but we need the evidence behind it. And there is evidence. I think a lot of times it's not put out there as much, and it's not recognized. So for example, one of the compelling arguments in Los Angeles is that when law enforcement alone responds to a neighborhood conflict, gang conflict, the likelihood of retaliation is up at 40%. When law enforcement responds and gang intervention responds in their separate lanes, the likelihood of retaliation drops to below 1%, which to us, that is extremely significant. And we'll see the same in other cities like in Chicago, New York, Oakland, Stockton, that are doing this work and really demonstrating what's possible when you start investing in a community-based public safety infrastructure and broadening out the ecosystem and understanding of safety. And it even goes beyond safety to include health. We're looking at healing, the impacts of community trauma, because every shooting, not only do the homicides and shootings have a direct impact on individuals and families, but also the impact of widespread community trauma. And that's what we're trying to address. And so, we're pushing for more funding for this, but we're utilizing the data to demonstrate our impact.
It's a great point. Thank you, Fernando. I want to turn to implementation now. David and Javon, as you both know better than I do, it's one thing to choose a smart strategy, but it's another thing to implement it well. What are some key points for our audience, many of whom are policymakers and practitioners in this area, in terms of implementation? What are the to-dos and not to-dos in this area?
So a couple of things. One, I just want to make this very clear is to ask cities, mayors, city administrators, policymakers, is gun violence a priority for you? And can you prove it? Right? Is there anybody whose full-time job it is in your administration to reduce gun violence? And if you say you're police chief, you don't know what you're talking about. And I'm trying to be very blunt, right? The police chief's duties are very small percentage on specifically reducing gun violence. And so start with assigning someone a high-level, competent, whose full-time job it is to reduce gun violence in the city and to coordinate with all of the community-based folk, because there's a bunch of people in the community whose full-time job is to work on this. And so coordinate those efforts. So if you choose this strategy of focused deterrence or gun violence reduction strategy, you can't add on to somebody who has 5 other duties, also manage this, a full-time director of this strategy. Also, understand that the goal is to reduce gun violence. The goal isn't right now to have community transformation and great healthcare system. Those are incredibly important. But if we're talking about reducing gun violence in the next 6, in the next 12, in the next 24 months, those activities look a little different. So understanding that if your goal is to reduce gun violence in the near term, you have to have a focus on the individuals at the very highest risk of committing gun violence now. So a full-time person, and also several management pieces. So the mayor needs to be involved. We need to have frequent meetings with all of the managers involved in the strategy. And the last thing I'll say around this is specific goals and managing to those goals. What are the inputs and the outputs that you know will achieve the goals, and are we doing those things? And so it should be a data-driven strategy that has focus. And so the last thing I'll say on this is focus, focus, focus. The cities we work in, when they get off of focus, we see the gun violence increase. Maintain the strict focus on the strategy.
Thank you, David. Javon.
So I'll focus on the system itself. I think that when you're designing any system that's mission is to support an individual, especially those that are at acute risk of gun violence, take CBT, for example, you just want to ensure that it's permeable for adaptations that are both informed through the participant voice, but also through the experience of the intervention by using evaluation and rigorous data collection. I know with our program specifically, even though we're showing promising results, we have and we still continue to adapt our CBT service model to ensure that we're meeting the needs of our guys, but then also too, to make sure that it's working effective. We use participant feedback, we use engagement trends, and we also use just existing published research that speaks to effective approaches and curriculum that we can use that will best support our guys. By pioneering such informed program shifts for a population that has been historically disconnected and also not specifically supported by other traditional services, we are helping to inform what works for this particular service population. And then also too, we're helping to create the narrative or even inform the narrative of how and why hurt people, because at the end of the day, those that are likely to be agitators of gun violence are most oftentimes victims.
Thank you, Javon. Great point. I think that that's a really interesting observation I just want to highlight, which is that often your research and evaluation efforts actually strengthen your implementation. They can actually help keep your program administrators honest in terms of reaching their intended goals. Great point there. I want to move on to what it means to be community-based, and what does this term or label mean? Paul and Fernando, we call these strategies community-based, but there's not a clear understanding out there on what the term means. So what does the term community-based means to you, and how are community-based approaches different from our traditional ones when it comes to violence reduction?
Sure, I'll go first. To me, it means that the solutions and the people doing the work are from the community. You can't have outsiders come in and tell us what to do and how to do it. However, I do think that sometimes outsiders who have had success can be helpful, but the partnership has to be respectful and inclusive. I can't tell you how many times, how many different communities, my own communities, people just don't like how some experts or rich folks or whoever come in and say, I got all the answers to your issues and this is how you need to do it. And it's not inclusive, it's not a partnership. It's more of we know better, you're ignorant, here's the answer kind of approach. And that's not helpful for communities. But at the same token, some folks are so protective of their area that they don't feel the need to listen to outsiders, even if they have had success. And that also is a problem, right? I attended a meeting once where a community member who's done the work for a long time stood up and yelled at everybody. We've all been doing everything wrong for 30 years, right? And then he sat down and he got a standing ovation. And I'm sitting there thinking, is anybody gonna ask him what I wanna ask him, right? And I decided not to because it wouldn't have been a good look with the folks that applauded for him. But I wanted to say, well, since you know we've been doing it wrong for 30 years, what the hell's the answer, right? Like, and I tell this to my staff, I got about 60 employees, and I say, I'm fine 100% with you pointing out deficiencies in what we're doing, what we can do better, etc. But when you have a complaint or you point out a deficiency, offer a solution, right? Otherwise, it's just complaining and more of the same. So, so I think sometimes communities can be too prideful in not embracing or sitting down with an outsider, so to speak, who can help. And so that's my 2 cents on the community-based side of things.
Thanks, Paul. Fernando?
Yeah, I mean, it goes back to when we're talking about reimagining public safety and including community in that conversation. And when you look at when everyone's talking about, hey, let's address structural racism, it's really a value shift in the country that we need to push. And saying, if you're going to address structural racism, if you're going to address all these inequities and gaps that we've known about for a long time, have been experiencing and have been exposed during these multiple public health crises, that shift requires seismic investment to really transform how communities, the community-based ecosystems. And as we look at the impacts of the criminal justice system and the disparate impacts on communities of color, and we're shrinking the criminal justice footprint, you have to expand and really build a community-based footprint. And what that means is going to exactly what Paul says, is making sure that people with lived experience, people that have backgrounds, people who come from these communities and leaders are invested in, trained, and not only have access to jobs, but can really help build the infrastructure that is needed to transform their communities. And I think having people in leadership positions, and it goes beyond jobs, it also includes really building infrastructure, support, and capacity. It's very hard to have a conversation with law enforcement when there's an unequal power dynamic. If there's not a community-based voice, right, that is empowered and supported, then it's easier to have, it's not as easy to have that conversation. But when there is, you can push back on law enforcement, start holding law enforcement accountable, and have more equal conversations. And so I think when we're looking at rebuilding new systems in the community, it's going to require shifts. And, you know, like we said the other day, $1 billion in South LA or South Chicago is a down payment for the amount of dollars that it's going to take to really transform this community. If you look at the criminal justice system, looking at $100 billion a year, right? Put half of that into these communities and see, you know, in any of these programs, and any of our brothers and sisters that are out there in the audience, and you'll see transformation. That's what the data tells us, but also that's what we know because we've lived it.
Thank you, Fernando. I want to sort of tease out something that in your response there and discuss the role of policing. So, you know, David and Fernando, you know, as Fernando said, we're in the middle of this national conversation on reimagining public safety, on, you know, the role of police and policing reform. You know, what's your take on this conversation, and specifically, what should the role of police be vis-a-vis these community-based approaches?
So a few things. I have the pleasure and a little bit of the pain facilitating these reimagining public safety discussions in a number of cities now. As a part of that is also doing some assessment of the police workload and calls for service. And so two quick answers. One is, what we have found is there's a large volume of calls that very few people think the police should actually respond to. And when I say very few people, I'm including almost 100% of the police officers I've talked to about this, right? And there are low-level, sometimes non-criminal calls. And in fact, the number one call for service in 2 of the cities we've looked at is a non-criminal call, right? That comes more often than what police respond to. It was a great op-ed written by a Chicago police officer a few weeks ago about spending an entire shift responding to things that he should have never been responding to, while somewhere across town, extreme gun violence was occurring that he wasn't, responding to or engaging with. And so we've got to shift law enforcement to focus not on the low-level stuff. There are community members, there are community organizations, we can invest in community much better to even stop the need for such calls for service. So that we certainly need a shift, and we need to have police focus on the things that, when you think about what we need or want police for, are those things. Second is this type of intelligence, data-driven solutions and information sharing. What we benefit from in many of the cities that we're working in is we are receiving, right? It's a one-way flow of information. Community outreach never gives information to law enforcement, but law enforcement provides very helpful, necessary information on shootings and connections and groups. And that data is imperative to focus intervention efforts on the right people. And so to have this partnership with law enforcement, but to do it in a way that makes sense and that they are providing the right information to intervention to focus on the right people.
Thank you, David. Fernando?
I mean, I think first and foremost, there's a crisis of policing in this country, as everybody knows, and we need to change the mission of American policing. I think that's first and foremost, and really change the incentives for how officers are incentivized to police communities, right? Really looking at some of the structural things. Part of it, and just going into what David was saying, is just there's been an over-reliance on policing, and officers that I've spoke to, they say the same thing. There's things that let us focus on the serious stuff. You know, we don't need to do this and that. So we can build out infrastructures for mental health responders, for street outreach workers, for homeless specialists, for people that can engage in other areas that are kind of nonviolent, non-life-threatening calls, and really kind of end that over-reliance on law enforcement, but broaden the idea of public safety to build broader infrastructure so everything is not put on law enforcement. So the over-reliance on law enforcement has really allowed departments across the country to build a lot of power, right? And to say, hey, look, everything is on us, therefore we need all these resources to do our job. But there's a narrative shift that's happening, and that's being pushed in multiple areas, even globally, about what is the role of law enforcement. And the mere enforcement of laws does not generate safety. Just enforcing laws does not generate safety, and that's part of the narrative that we have to change. And as we do our work day in and day out, thinking about this, working on this every day, and learning every day, is we're understanding that to generate safety, it's going to take more than just an imposition of laws. And we can really build out alternative structures. And law enforcement needs to be able to back up enough to give space for example, for street outreach to go in and do their work and do what's necessary to create peace. And I think that's a big piece that we're pushing, and we're starting to think about, and we're starting to have to really be creative and innovative and build infrastructures. And we need private public support to do that. So not only is it resources, but it's also public opinion, shifting the narrative, shifting the values of this country, that we're not going to incarcerate our way out of this problem, and we're not going to police our way out of it.
Thank you, Fernando. So I want to end with you, Paul, and Javon, and I want to get to this issue that Fernando just mentioned about funding and the relative lack of funding of these strategies that have been proven successful. So, given the high cost of homicide, there's many estimates, but a lot of estimates estimate over $10 million per murder. All of these programs essentially pay for themselves many times over, even if they're only moderately effective. So why do these strategies still struggle to get funding and stay funded, and why aren't more strategies adopting them? Paul, I'll begin with you.
Okay. Well, I think the first easiest answer is politics. I mean, that's just a fact. Every time a new politician is elected, he or she has his or her own motto or approach that they either came up with in their sleep or in the shower and want to implement it and be famous for it, or the lobbyists or their union that got them in office or what have you, it's pushing them to implement X, Y, or Z motto. And sometimes it's helpful for us, and sometimes it puts us back 10, 15 years, to be honest. So politics is always an issue, and I think everybody will agree to that. The second thing is there's just not enough funding, right? As Fernando was talking about, and I think everybody touched on at some point during this panel, is that there simply is just not enough funding. Another reason is, I mean, this is just my opinion, I think sometimes we work ourselves out of funding, if that makes sense. So if, for example, look at the grid, right? And what we're able to do in the city of LA with funding from the grid, contracting intervention agencies, street workers, is we had 50-year lows in homicides. And so what happened over 10 years, right? And thank God for the grid, but we had no increase in cost of living, no increase on the average amount of contracts for over 10 years. And it prevented us from recruiting new generation of workers. It prevented us from innovating. Some of it is our fault as service providers, but some of it is also the fault of elected officials in the city of LA. And so that's another issue. And then as a result of those things, what happens is what's always happened is those of us that are on the ground fight for what's left over, right? For the crumbs that kind of trickle down. And then you see a lot of unhealthy competitiveness and people promoting themselves as the technical expert of the universe, right? And there's a lot of that going on right now, and you kind of can't blame folks, but it's not healthy for the work. And I see a lot of LinkedIn accounts and flyers and whatnot of the greatest expert that ever lived on the planet. And it's like, to me, if somebody has to promote themselves that way, it says something about them, because if somebody's good at what they do, people will call you. They'll hear your work, they'll see your work, and they'll call you. But I think that's a result of the lack of funding, is it creates an unhealthy competitiveness between those of us on the ground.
Thanks, Paul. Javon?
So I like to call it convenience funding. And here's what I mean by that is that we have to be more active in pursuing innovative ways to spend our dollars. We can no longer continue to fund without the support of our private foundations. We can also no longer continue to fund in silos and base program performance solely on broad stroke deliverables, especially when you're supporting communities with complex issues of survival. It takes more than just getting a person a job. You want to provide them pathways to stability. So working on even housing concerns, childcare concerns, mental health issues. It's a whole pot of interventions and supports and resources that are needed where just funding from one potential government department is just not going to be enough, and it's not going to sustain positive results in the community. Silo government funding that's based on quantified deliverables just doesn't make sense anymore. And that's just the bottom line. We need commitments for sustainable funding that let programs that let programs base their performance not only on quantified measures, but also quality, the participant experience. Were they able to have some level of increased stability than where they came in beforehand into the intervention and how they presented? And I think with that, we can open up new pots of new interventions and also to create more capacity within the communities to be autonomous eventually. And hopefully we are out of jobs where we no longer have to look for government funding because our communities, all communities have public safety.
Thank you, Javon. I want to just pull out one point that you made and one point that Paul made. Javon, I think it's so important to note that most of the time when we measure the quote unquote effectiveness of these strategies, we're doing it in terms of outputs, like McDonald's, like numbers served. It's not really on outcomes. Have people's lives actually improved? Are they free from violence? Have they not been incarcerated? Those sort of hard measures. And we really need to keep ourselves honest. And then I think, to Paul's point, there's a real challenge, I think, not to the practitioner community, but to the political community, which is that it's not that these strategies don't work. They work again and again and again in cities all across the country. They don't work sustainably. They don't work. It's very hard to put together a 5, 10, 15-year track record. And so that question is really for the political community. If a programmatic community can show that what it does works over a short period of time, the political leaders have to create an environment where that work can continue across political administrations. And that really is the rub. It's not, can we do something? It's, can we do it consistently enough to really transform people's lives? So with that, this has been a great discussion. I think we should welcome the audience in to get their questions as well. So Abby?
Thanks so much, Thomas. And thank you to all of our panelists. This has been an incredible discussion. We have so many questions coming in from our listeners today. I'm going to do my best to ensure we get to many of them, but thank you to everyone who's been participating in the Q&A so far. There's a question that we have from Sean, and David, I'm going to come to you first because you spoke about coordinating across systems and stakeholders and how important that can be to the work. To do that effectively in a given jurisdiction, do you feel that it's mandatory to have city and government involved in some degree, or is it possible to do that without formal involvement from city or county government?
So I think it's possible, but extremely difficult, also extremely unlikely. And because government is where the greatest resources are, they should be involved, and it is their responsibility. So we actually shouldn't take government off the hook. I have had many people approach me in the cities about this. So foundations saying, can we just fund this and not, wait on the government? And I understand that because of the slowness, the bureaucracy, some of the political challenges Thomas just mentioned, but we cannot and we should not take the political leadership, elected leadership off the hook. And that's where the resource is. The other piece is there's so much going on in many of these cities. There's other cities where there's not a lot going on, but there's so much going on that there's real need for coordination. And so that we're leveraging our resources appropriately. I've found in so many cities, grants, city contracts, county contracts, state contracts, federal, are all going to the same organization. There's no coordination. They're serving the same person, with the same dollars. And as much as many of these community organizations need more money and more resources, the level of coordination and leveraging is not what it should be. And often we need the support and the information and the funding from government to do that level of coordination.
Thanks so much for that, David. We also have a question from a number of listeners about the role that restorative justice approaches play in your various interventions. And this question could really be to any of our panelists. How does restorative justice factor into the work that you do through your programs?
Paul or Fernando, would love to hear from you two on this.
Well, I'll go first with my experience, although I don't have much with restorative justice, and we had some restorative justice programs for a period of time that we were funded to do at my organization. And I remember that it really focuses on the role of the perpetrator and the survivor and how each get to the point where they're a perpetrator. And oftentimes, many perpetrators have also been victimized, which in many ways forced them to end up becoming a perpetrator, right? And just the role of the community and how both roles develop and interact, and then the healing process after a traumatic incident has occurred. I know there's some very difficult, I'll say, restorative justice practices where they actually will try and get the specific victim survivor with their perpetrator, which I think is very, very dangerous and can backfire in terms of trauma and re-traumatizing somebody, etc. So we have never gone that far in our restorative justice efforts, but it's been more along the lines of working with ex-offenders getting out and getting them to realize that the fact that they were also victimized at some point in their upbringing, and then partnering them with survivors, but never necessarily connecting them with their exact perpetrator, because I think that's very dangerous.
Yeah, there's informal restorative justice programs in LA that work on that. There's also informal practices, just even with street outreach. As far as being able to kind of mediate situations does not involve law enforcement, right? And I think those are the things that go under the radar. I think there are practices that that can be, they go on all the time actually under the radar, but also formalizing them. I think as Paul is saying, is that there are groups that do it. There are a lot of advantages to that kind of not place the hooks of the criminal justice system into individuals and providing alternatives. So in LA County, we're focused on alternatives to incarceration. We're looking at pre-arrest diversion, and we're looking at ways to divert people from the criminal justice system. I think restorative justice is a way that can be fully developed and implemented into these larger strategies. I think coordinating strategies that David was referring to.
I would also just point out that restorative justice is a very broad strategy, and it may have higher and better uses in less serious offenses. Reconciling two people who have been using lethal force against one another or against each other's families, that can often be a very challenging set of circumstances.
Thank you to everyone for your perspective on that. So this next question, Javon, I'm going to come to you first with this. So many people in our Q&A are commenting that it's so wonderful to be hearing about programs, especially programs like READI Chicago, that are being evaluated through your RCT and proven, your effects are being proven. What can our audience today do to lift up that impact that you're seeing? Are there policy changes that you think would help to expand your impact, or just what can our listeners do to support the kind of work and the kind of results you're seeing?
Well, I think the easiest recommendation, and I have seen, and we are experiencing, and even we have reached out to other cities, is just expanding the wealth of knowledge at the grassroots level. It's just extremely important to get intel from other community-based organizations nationally, within your own community, even within your own city and state, in terms of what they're doing well, and kind of use them as a sounding board in terms of just continual program improvement. We're fortunate, yes, to be connected to an RCT study. Not all programs are going to be fortunate enough to have that connection. However, tools, evaluation tools, assessment tools, these are things that can be easily translated and even copied into current program models, where they can now begin to kind of evaluate their program efficacy for themselves, but more at a grassroots level, where they're really taking into account not only, again, the quantity of their results, but also the quality in terms of their participant impact.
Thank you so much, Javon. Do any of our other panelists want to respond to that question as well? Well, then great. We have covered so many topics in our discussion today. It's been incredibly informative around your specific strategies, the challenges you're facing, and opportunities for progress. So before we close out our Q&A, I'd like to ask each of our panelists, is there something in particular you want to make sure that our audience takes away from today's discussion? So I'll come to each of you. Perhaps David, we'll start with you.
Great. I was going to say, I have to leave to prepare for the same discussion that the National Office of Violence Prevention is hosting. I know many of you all are joining. But I just really, really want to thank you all, CCJ, for this discussion. So I would just say, and I've been attempting to answer some questions in the Q&A. So I would just say that this notion of focusing on gun violence, I'd really appreciated that question around how can we do that in isolation, and we shouldn't, right? It's understanding that if I'm a mayor, I need to focus on revitalizing communities. I need to focus on the education. I need to focus on ending homelessness, on economic development of the city, the health of the city, transportation. All of those are extraordinarily important, as well as gun violence. But each of those have specific strategies and programs that are effective at improving them, right? Just like gun violence have specific strategies, as we've discussed today, that are effective at improving them. And so the example I give, which is a real example that happened to me several years ago, where I had a city council member say, we need to reduce gun violence this coming year. In the next 12 months, we're going to have a mentoring program for middle school students. A mentoring program for middle school students is wonderful. It will never achieve gun violence reduction in the next 12 months. And so being very clear about what interventions produce what outcomes, but stepping back, I want my community in East Oakland to never need ceasefire. Just like Piedmont and Oakland, a white wealthy community, they don't need ceasefire, right? I want my community to not need it, right? But I also know right now, unfortunately, we do. And so we've got to do the work to transform the community and keep those residents there, as well as the immediate work of reducing gun violence.
Thanks so much, David. Paul, I'll come to you next.
Sorry, I was trying to answer one of the questions on the Q&A. I would just kind of echo what everybody has said. I think if perhaps the viewers can kind of synthesize everything that has been said and put it into a package. And I think the most important thing is probably the collaboration. And I think David touched upon it a lot, is there's a lot of silos. We've all participated in silos and are probably doing it now. And sometimes because it's our only option to help. But I think the collaborative approach is definitely key in terms of trying to reduce violence in a particular area. Is the most important thing for me, and that's probably the main point that I would like to get across to those that are listening to this panel. And thank you for having me.
Thanks so much, Paul. Javon, would you like to go next?
Absolutely. I think the takeaway here is that now is the time to be bold. We can no longer continue to accept the status quo. We have to be loud and vocal about services and supports that sufficiently meet the needs of our communities. So that's really what I want to echo. We cannot no longer sit down. We have to be bold and stand up. We have lives at stake here.
Thank you, Javon. And Fernando?
So ditto to the being bold. Now's the time, and we say if we don't do it now, it's not going to happen. So the momentum's here to push these conversations. I think for public leaders and philanthropic leaders, it's just important to note is that you all, as far as, the role that you play in kind of providing that leadership that David is talking about is really, when we talk to mayors or we talk to any kind of public officials in different cities, is really assessing the political will and the dynamics that exist and being able to tailor treatment plans for the community, right? To say, hey, look, so that's one side of it. The public sector side of it is really important. And that leadership is important to get public funds, to get private funds, and to get them down to the community. So that piece can't be overlooked. And for folks that are asking, like, what can I do as a law enforcement leader? What can I do as a city leader? Engage in the conversation. Sometimes it's not, and with UPI, we always talk about, it's not, UPI doesn't have a model. There's models that are out there that work, but sometimes you just need to supplement them, you need to tweak them and tailor them to your communities. We've seen advanced peace, cure violence, and ceasefire all in one city, which is great, but how do they all interact? And then how do you kind of supplement, and what's the infrastructure that's needed? So there's the city side of it, but if there's not concerted investment in building a community-based infrastructure to sustain this, it's not insert here, violence goes down automatically. It's long-term infrastructure building, investment, relationship building, accountability that many times gets overlooked, but you have to have people, community buy-in in order for it to be effective. If there's no community buy-in, if they're not a part of it, it's not going to work. It's only going to be top down. Violence might go down for 5 years, but you'll see it go back up because you did not take the time and investment in the infrastructure to build community buy-in.
Thank you so much, Fernando. And Thomas, as our moderator, we'll come to you for a closing word on this.
Sure. Thanks, Abby, and thanks so much to our panelists. I think our audience members would agree. You guys have been extraordinary, and your contributions are very much appreciated. I guess what I would do is just note that we began on a sort of sobering note about a significant spike in homicide, but I'd like to end on an optimistic note. And I'd like to note that urban violence is not intractable. It's not an impossible challenge. We can reduce urban violence, and in fact, we have on many different occasions. And these strategies, as you've heard, are cost-effective. They're proven. They don't require new legislation. They don't even require deep institutional reforms. These are ready to be implemented now. So please urge your leaders to do the right thing here and respond right away. Lives are at stake, as Javon said. Thank you.
Thank you to all of our panelists today, and thank you to all of our listeners for joining us for today's event from the Council on Criminal Justice. We hope you join us again for a future discussion, and we hope that you have a safe and healthy rest of your week. Have a great day.